Neil, how are you feeling today?
Good.
It's good to see you again. I know we've had some conversations by phone, and I understand you're interested in some more information on our male penile lengthening and enlargement procedure called phalloplasty. Assuming, as we know, you're in good health and that you know that this is not a treatment for any sexual dysfunction, it's purely a cosmetic enlargement. We do it right here in this fully approved facility under a light general anesthesia. That means you're going to be totally unconscious for it. You'll see nothing, hear nothing, feel nothing. You'll stay here a couple of hours to recover in the recovery room where the nurses will attend you until you're ready to go home, and then someone will drive you home. You can't drive yourself home. All right. Do you have any specific questions at this time before we go into the full?
I have a couple questions. What kind of results can I expect to see in size and thickness? Second, if I was to get both lengthening and thickening, could that be done in one procedure, or do I need to come back several times? Of course, is this procedure safe? Could I experience any problems with erection or ejaculation or urination post-surgery? And then, of course, finally, how long till I can resume normal activities, normal physical activities post-surgery?
What I prefer to do is have me go through the whole consultation, and then if I haven't answered any of your questions at that time, we can get into the specifics and take care of it then. The other thing that I want to make you aware of is that if anything I tell you doesn't jive with your expectations of what the results are, how long it's going to take to achieve them, and what your commitment to the program is, don't feel that you have to do anything that you're not really comfortable with.
Okay. Some of the questions I had were, if I were to get both lengthening and thickening, could they both be done on the same procedure, or would I have to come back for two procedures? I was concerned about the safety. Could there be any problems with erection, ejaculation, or urination post-surgery? And finally, how much time would I be off work and not be able to partake in any kind of physical activity?
Okay, these are very important questions, and we will answer them all. But first, let me tell you what's involved. As I said, we do this right here in this facility. Now, there are two aspects to the procedure, the lengthening and the thickening. About 90% of the men that have the procedure have both procedures. Another 5% just have the lengthening, and another 5% just have the thickening. So it's an elective cosmetic procedure. The way that it's done is that the lengthening is only done once, and we do that with a laser release of the internal ligaments that hold your inner penis to the undersurface and behind the pubic bone between your legs. We also at the same time do a thickening. Now, the way that I prefer to do the thickening is called a free fat transfer, and this is done by taking fat using specially designed micro liposuction instruments that I designed to take the ideal pieces of fat in the way of size and texture. We purify the fat, concentrate it, treat it with special nutrients, and insert it under the loose skin of the shaft of the penis. We cannot enlarge the head, only the shaft. We'll get into that shortly. Now, we know from our experience that the worst thing that you can do is put too much fat in the first time, because this being a free fat graft means that we're taking it outside of the body, outside of its blood supply, and putting it in a different place, so it has to develop another blood supply for it to survive and to become a permanent part of your penis. And it does this by blood vessels from the skin and the shaft of the penis grow into this layer of fat. Well, blood vessels grow very slowly, so if you put too much in, they're not going to be able to reach all of the internal portions of this new layer of fat, and the fat will die and absorb. And the only problem is that it never absorbs evenly, so the penis could come out looking lumpy and uneven, and this is what happened in the beginning 10 to 12 years ago, when some doctors mistakenly thought that putting in more fat would compensate for the fat that disappeared, but this was the exact wrong thing to do. So I developed what I call the two-stage procedure, putting in a nice bed of fat, allowing this to graft completely, and then you can add on that indefinitely. And that takes about 3 months for that to become permanent. Now, that doesn't mean you can't use it for 3 months, and we'll get into those restrictions. So anytime after 3 months, we can do what's called the second stage. That is, complete the filling if you need it. Now, only about 70% of the men that have this have only one procedure. The rest come back to have the second stage, and half of those come back only because they want to keep on enlarging it, not because the fat has not survived. And it's an extremely safe way of doing it. The other procedures that are done, most of them have been abandoned now, except for alloderm, and I don't think anyone is doing the dermal fat grafts on a regular basis. So I found that in the almost 4,000 cases that I've done, that this is the best way and the safest way to do the thickening part of the procedure. So after that's done, your penis will be wrapped, which you will keep a wrap on for a week, and in 2 to 3 days you can be back to your normal activities, assuming that your job is not one that requires a lot of physical activity like construction or any heavy-duty physical activity. The other restrictions on activity is no sports or exercise for a month, and no vigorous sexual activity for 3 to 4 weeks. That's either with a partner or by yourself. You do some mild stretching, and then there's a stretching device that has to be used at about 2 to 3 weeks. And this does two things. It keeps the penis in a supported state so that the fat does not clump up or lump, and so that the thickening is more successful with this. It also prevents the natural tendency of the body to pull the penis back from the advancement procedure we do, and it can actually complement the surgery by stretching out more penile length over a period of time. So that's part of the program too. Now, to get into the actual lengthening part of the procedure, this is done by using a laser through a 1-inch incision in the pubic hair and release the attachments of the penis from the undersurface of the pubic bone. There's actually 5 deep ligaments that need to be released, and the penis safely advanced forward. I then restabilize it in the forward position so that your angle of erection is the same as it was before, and the angle when you're soft or flaccid is the same. You will note an immediate gain in your soft length, your soft thickness, and your erect thickness, even through the bandages that we put on for a week after the surgery. However, it's most important that you understand you will not see any length gain in the erect state for 4 to 6 weeks, and gradually after that you will get your final extension over a period of time of 4 to 6 months. And during that period of time, you're, of course, doing your stretching. So that the first time you get erections after the surgery and it doesn't appear any longer, and if there's a lot of internal swelling, it can even be 1/4 of an inch shorter, and this is only temporary, so don't panic and think something went wrong. It's very safe. We've never had anyone who had any permanent disability, no interference with permanent erections, permanent sensation, or ability to function normally, urination or ejaculation. So all in all, it's an extremely safe procedure. Any other questions that I haven't answered at this time? Good. Now, at this point, I'm going to give you an examination and tell you what I think your chances of achieving your goals are. If you have anything other in the way of goals that we haven't talked about, now is the time to tell me.
No, I think you've answered all my questions.